Welcome to the Ideas Step 5 module. This step is part of the Intervention Design and Analysis Scorecard tool for creating integrated total worker health interventions. This video will give you a basic introduction of how to complete Ideas Step 5 as you work through the ideas process. You can find videos for all the ideas steps on the CPH-NEW Healthy Workplace Participatory Program webpage. The goal of Ideas Step 5 is to rate and select which interventions to implement. When using a two-committee structure, the steering committee rates the interventions created by a design team. The best way to accomplish this step is for the steering committee and design team to meet together to present and discuss the proposed interventions. Idea Step 5 is the culmination of a stepwise design process to develop different intervention options to address a specific safety, health, or well-being concern. Up to this point, the design team has used the Ideas step-by-step process to assess root causes of a specific safety, health, or well-being issue, brainstorm solution activities to address the root causes, develop selection criteria or key performance indicators to evaluate each intervention option, and form 3 intervention options and apply the selection criteria to each one. In Ideas Step 5, the steering committee takes an active role in learning about the interventions and deciding what to implement. The rest of this module will show you the details of the Step 5 process. The design team may use the terms on this slide when they present interventions. An intervention package is a set of activities that comprehensively addresses a major safety, health, or well-being concern. Why a package? Interventions are most effective when they address as many root causes as possible. This holistic approach is a defining element of total worker health interventions. Selection criteria are measures or performance indicators to evaluate the feasibility and the effectiveness of an intervention. These include scope, benefits, resources, and obstacles. This video will show an example of how to use the selection criteria to rate each intervention package. The ideas process calls for creating 3 intervention options. What is the rationale for this? Creating a business case for 3 options can help you see the trade-offs for different kinds of intervention approaches, help set realistic expectations for proposed solutions in terms of resources and impact, and it also can help build buy-in for allocating the resources needed for supporting high-impact solutions. Idea Step 5 is highly interactive. First, the steering committee and design team will meet for a proposal presentation. Design team members will present 3 intervention packages they developed. The goal is to support at least one of the packages. During the presentation, the steering committee's role is to listen and ask clarifying questions to understand the rationale for all of the intervention elements. Try to learn as much as possible. You will make decisions later. Next, the steering committee meets separately to rate each intervention package and select which intervention should be implemented. It's important that the steering committee communicate their decision with the team and with the employees to be affected. You will use 4 types of selection criteria when rating the 3 intervention packages. These criteria should be written down in the Ideas Step 3 worksheet. You will use the criteria to rate each intervention option according to the 4 selection criteria shown here. For example, for scope, how well does each intervention package reach the targeted employees? For benefits, how well the intervention package achieves the desired outcomes? For resources or costs, what level of investment is required? And for obstacles, how serious are the obstacles, if any, to the intervention? Now that you have a general sense of the rating criteria, let's review how the rating process works. This slide shows an example of a rating sheet for a fictitious case example of interventions aimed at reducing burns from coffee spills in a coffee shop. We see interventions A, B, and C at the top of the screen, and the 4 selection criteria listed in the left column. In this example, a rating scale of high, medium, or low is used for each selection criteria. A rating of high indicates the intervention meets or exceeds the stated selection criteria. A rating of medium indicates the intervention only partially meets the selection criteria. A rating of low indicates the intervention fails to meet or barely meets the selection criteria. The ratings are applied for each selection criteria to evaluate all intervention packages. After you complete the ratings, it's a good idea to discuss and interpret the overall strength of each intervention option. Based on the overall strength, you can rank the intervention options. Then, you can use the space at the bottom of the form to identify which interventions you recommend for implementation. Also, note any concerns and the reasons for any modifications you recommend. It's important to communicate decisions and recommendations to the design team in a timely way, ideally no more than 30 days after the design team proposal presentation. Communicating in person is ideal. There may be differences of opinion about decisions, and these are opportunities for learning through discussion. An in-person meeting also allows for discussion of next steps, including generating ideas about how the design team can be involved during the implementation phase. One of the goals of a participatory program is to increase collaboration and communication about safety and well-being. During Idea Step 5, you can achieve positive and productive interactions by focusing on two key values. The first value is mutual understanding. The proposal presentation is a time to learn about different perspectives. Some ways to increase learning are: listen without interrupting, ask clarifying questions, and acknowledge different perspectives. The second value is trust and respect. How we communicate makes a difference for winning people's goodwill. Some specific ways to communicate with respect are: assume good intent. Begin with the assumption that everyone is committed to improving safety and well-being. Invite all participants to contribute to discussion. This signals that we value different perspectives. Give balanced, constructive feedback. Focus on the positive as well as any concerns. Suggest possible ways to overcome the concerns. Respond in a timely way. After the proposal meeting, schedule a follow-up as soon as possible to keep the momentum. Now that you have a basic understanding of Idea Step 5, you are ready to rate and select interventions. With the help of your champion, use the Idea Step 5 guide and handouts to complete this step. This concludes the training module for Idea Step 5.